Yeah, welcome back to DXB today, where we've just realised that we should be charging a consultancy fee for the show today as well. Not one, not two, but three medical opinions for you to help you prepare best for the summer and, of course, to survive the coming months. Our next guest is a consultant bariatric surgeon leveraging his expertise in treating weight-related issues to deliver exceptional care to patients of all ages. Please welcome to the show Dr. Samir Rahmani. Thank you so much indeed for being with us.
Thank you very much.
Great to have you on board. As the summer descends on us, look, we know that the obesity epidemic, the disease that is obesity, is a scourge, not just the UAE, the region, the world at the moment as well. And it is something that affects all ages. We've got a big problem with teenage obesity here in the region and further afield as well. I'm just thinking, summer, more time inside, less activity as well. Is summer a friend or a foe for those that are suffering from obesity?
Thanks ever so much. Yes, summer is always a tricky time for obesity, especially teenagers. And I'm talking about teenagers, especially people who are heading for universities. Yeah. Because teenagers heading to university, like grade 11 or 12, for example, these are at critical stage because they're going to a very crucial part of their life. They want to be shape aware, they want to be really well, and they want to feel good, look good, because that's the image going to be imprinted on their life for the next 5-6 years at the university. So I do get a lot of teenagers, especially in this part of the year, trying to get sorted, especially after they finish their grade 12 exams, before they actually start the university
Big
year
move
one.
Away as well.
Big move away, yes, yeah. So I do see a lot of drive for this, but equally at the same time, people want to go away, people want to relax after having a heavy run of exams for grade 12, for example. So it's always tricky, but I do get, and I do advise all people, and I will do it for my daughter or my son, before they go to university, they need to get sorted. Because it's not only look good, it's feel good, they want to exercise, they want to go for trips, etc. They want to really get themselves sorted. And there are many ways of sorting this out, especially nowadays, because it is, as you said, it is an endemic now. It is about 1 in 3 people suffering from obesity all over the world, not only in UAE.
So, Doctor, you were saying there, like, to get things sorted. Like, what would you recommend? I mean, we're talking here about, like, surgery. Would you say that this is one way to fix
it is the last way
issue?
To fix. Yeah, it is the last way to fix. So, first of all, they have to be aware of their calorie intake. They have to be counseled by specialists. We have in our team, for example, we have eating disorder specialists who can coach them for a few months, have some personal trainer, do some regular exercise, and then maybe with a combination of some injectables, maybe doctor before me, she knows more about it as a family physician consultant. So it's a combination of these conservative measures.
Okay, so you're not just going to put somebody straight in for like a serious surgery. Because that was going to be my next kind of question. You know, there's lots of medication out now, like such as Ozempic, etc. Would you recommend using something like that before going into a surgery?
Yes. So it's usable at 2 extremes. So that's what I tell people. So when they have a little bit of excess weight, maybe 10-15 kilos, so it's a bit of diet, some exercise, some injections, then this would be feasible. And I also use it for people with really big excess weight, like they have 90 kilos of excess weight, 100 kilos of excess weight. So I use them as a bridge therapy. So use medication to drop their weight to make them more fit for surgery in a few months' time. But the advice is just to have a set period of time and a target. It's not like I'm going to try exercise, diet and injections forever. No, that doesn't work. So I have 6 months, I have to drop that weight. If it is doable, then happy days. If not, and your body mass index is really high, and if you have other problems, then it's really the way forward is surgery.
Okay.
Samir, I've got a broad and a slightly tricky question. I think we're all familiar with the sort of 4 pillars of a healthy lifestyle: diet, exercise, sleep, and the social thing. I don't know the answer to this. Which do you think is most important if you have to focus on one?
If I have to pick one, Andrew, it will be sleep.
Oh, wow.
Okay? sleeping pattern is very important because our hormones get changed big time by changing our sleeping pattern. And we see nowadays, even on the weekend, kids change their sleep pattern. They start to sleep late and wake up late, and when they wake up, they don't know whether this is breakfast, lunch, or an early dinner.
Sure.
Yeah. And they often get, okay, I missed breakfast now. I might have just some takeaway. They don't walk anymore. They use scooters. Yeah. This is the easy in our compound. I don't see anybody who's walking. They're all kids. Like I'm talking about 10, 12 years old. So it's not the diet. It's not the exercise. It's just the lifestyle, as you said, Andrew. Yeah.
Doctor, I just wanted to ask you, some people tend to do the bypass surgery or like the surgery that where you cut like, I don't know, 75% of your stomach, something like that. Yeah, so I'm not sure, which do you recommend for what cases? Because I think a lot of people would also not know what's happening or what they need.
So thank you, that's a very good question. I think most people know now because these are very old surgeries.
Yeah.
So we have a sleeve and a bypass, different type of bypass, So the way we choose it depends on the patient's health. So if the patient is diabetic, if the patient has reflux, if they have other problems, if the excess weight is really high, if they are chocoholic, this will push us slightly more towards doing a bypass. Because sleeve is a metabolic surgery, so it's not only making you eat less, it will make you burn more. While bypass, in addition to these two, will make you absorb less. It's about 25% reduction in your absorption. And that's why they have to stay on vitamins for a long period.
That's what I wanted to ask, because a lot of people that do the bypass tend to lose their hair and their nails get weaker because they're not getting in enough.
That's only in the first 3 to 6 months. But this is a very fun question because I get patients who are diabetic, hypertensive, high cholesterol. They are on a big bunch of medication, and I tell them, you're going to chuck all this in the bin and you're going to go on one multivitamin tablet. So, I'm going to stay this all my life. I said, yes, but that's one tablet versus many tablets.
So, Doctor, I don't want to put you out of work when I ask this question, but we've got to, how do you think we're going to like re-educate the young people now to maintain and have a healthier lifestyle? Because ideally that's the hope, isn't it, that they don't need to go for surgery, they can educate themselves. So what steps do you think we need to make in society to make that re-education?
It's a simple answer. It has to start with the parents and the school together. And we have to watch our children all the time. So for my kids, we have a scale there, like every day or two they have to check it, and it's not abusing them, but just to be aware of their weight and what to do. But I see very little efforts from school, to be honest. And this can be improved in the future because it's getting worse. It's getting worse. People are getting more lazy. People are getting driven easily to everywhere.
Things get driven to you, don't they?
AI and metaverse and all of that. People are just saying,
it's not getting better, I think.
Yes. Very
definitely.
True.
Well, thank you so much for joining us, Doctor. It's been a pleasure to have that incredible insight. I think you're going to stay with us now while we actually get to know Dr. Andrew a little bit better, because Ahmed is the man with the questions. It's
so
DXP
we've got
in
something
60.
called DXP in 60, and we just tend to ask you a couple of questions in 60 seconds to get to know you better. So are you ready?
I'm ready.
Okay, I'm going to cue the clock in
No one told me about this.
It's a surprise.
Thanks.
I'm going to cue the clock in 3, 2, 1. If you weren't working in the medical field, what would you be doing?
I'd like to be a pop star.
Okay, that's nice. What kind of pop star?
Rock and roll.
Okay, nice. What is your motto in life and work?
Do the best you can.
Okay. And your go-to restaurant in Dubai? I know it's hard.
Koya.
Koya, okay. And what is the top tip to help survive the heat in the summer? I know we talked about it a little bit, but one tip.
Stay indoors.
Okay, fair.
Or travel.
True. What's your favorite way to stay active?
I'm a cyclist. I spend a lot of time on a bicycle. I used to race motorbikes. I crashed them, so now I'm on a bicycle.
I spin every single day. So we have something in common. Your go-to relaxation spot in the city?
This kind of comes back to the restaurant a little bit. I love the lime tree. I've got friends, we meet every weekend for breakfast. So down there, and then can walk on the beach.
Okay, and just one last question because we ran out of time. Why Dubai?
That's a long story. I can't tell you that one. Not in 60 seconds.
Okay, fair. One word.
A plane.
Okay. Nice.
An opportunity.
Well, thank you so much, Doctor, for joining us on today's show.
Andrew, can't thank you enough for joining us as our guest co-host today. Thank you for your professional insight. Enjoy the summer.
Thank you.
And we will get you back on very soon. And Samir, thank you so much.
Thanks very much.
Really good to see you.
Good to see you.
Great summer.
Thank you.
And thank you for all of your thoughts.
My pleasure.
Right.